The following segment is sponsored by Northern Nevada Health System.
We're here at Northern Nevada Health System with Sedona Shonnard, who is a doctor of physical therapy, talking about stroke. Good to see you again.
Good to see you.
So how can a stroke patient benefit from physical, speech, or occupational therapy?
So with occupational and physical therapy after a stroke, we work at making sure patients can get back to things such as using the restroom, going to the kitchen for making meals or even eating meals. So occupational therapy is much more involved with the actual act of doing things like feeding themselves, dressing themselves. And then physical therapy is working on how are you getting out of bed? How are you transferring? How are you walking? And returning as much function as possible after a stroke, depending on where that stroke is located in the brain.
So what does a typical therapy session include for a stroke patient?
Yeah, a lot of times, looking at the gross picture, every stroke patient is different, so they have different deficits, but a lot of times we're going to be working on a lot of endurance, so aerobic activity, which is amazing for the brain, balance, gait training, and like I said, some of those transfers. Also trying to return as much strength and motor control as possible to some of those muscles that might have been affected by the stroke.
So are there some sort of support groups out there for stroke patients at all?
100%. And actually we have our own stroke support group that is not only for the survivor, but also for the caregiver. We do that once a month, and we meet for about an hour. We have the caregivers and the survivors separate so they can kind of talk about what's going on in their lives from each of their perspectives, and then we all come back together and kind of share what's been going on in each point of view.
So how quickly after a stroke is a patient encouraged to come seek physical therapy?
I would say after stroke, it's very important to get therapy. So right after a stroke, you have about 2 to 3 weeks where you're going to get the most return come back from that stroke. After that, you have about 6 months of, on average, everybody's different, right? But the first 6 months, I would say, are the most important. So as soon as possible, short answer.
Okay, very good. And for much more in recovery and everything to do with stroke, go to our website.